Why, hello there, and welcome to this video. Back when I was a freshly cracked egg, I scrolled a lot of Reddit and I watched a lot of YouTube videos talking about HRT and transition, giving tips, talking about all that wonderful stuff, trying to figure out how can I get the most out of this as possible. And something that I heard all the time, all over the place, in every thread, in every video, was your mileage may vary. And I'm not gonna lie, there is truth to that. Like, we don't have enough research on it, but I think that an early best guess would say that the your mileage may vary part of HRT has something to do with like genetic expression, because like sex hormones are like a signaler for the rest of the body to tell it what to do. So when you take hormones and change your hormone profile, it signals a cascade in the body that causes things to shift, including like gene expression, which then causes the phenotype to change. So essentially, like the way that your genes are translated into proteins and stuff like that, that stuff changes, which is why we see changes with HRT. And there are maybe some things with like certain amounts of plasticity within gene expression that some people have or don't have, or something like that. But besides that, I feel like a lot of the times the your mileage may vary thing is sort of just a caveat put there to sort of like say like, hey, it's if it doesn't go the way you think it should, then it's your mileage may vary. And again, while I do think that there is an element of truth to that, I do think that sometimes the your mileage may vary statement is just sort of thrown into the conversation to say like, hey, if you do the thing, if you do the HRT and it doesn't work out the way you want it to, sorry, nothing you could have done about it. And I think that's sort of a misrepresentation of the truth. I think the truth is that there are actually many things, including lifestyle choices, that can help you benefit the most from HRT. And that's why today I wanted to make this video talking about some tips that I have if you're about to start HRT, or if you're already on HRT, some tips that'll help make sure that you're getting the most out of it. So if you're new here, my name is Leah. Hello. I have been making transition content lately. Prior to making all this transition content that I've been making, I was making news and politics videos. I was sort of doing that leading up to the election, and I've sort of switched a little bit here. I may start covering more news and politics and current events again, but I've sort of just been on a kick of like making like transition tips videos and stuff like that. So I'll have like some more plugs and more stuff about my platform and whatnot after, but let's go ahead and jump into the video. And before we get started, I do have to say I'm not a doctor. I'm not a licensed medical professional. I studied health and anatomy when I was getting my license to be a medical massage therapist, but that is a far cry from a medical degree. So I'm not here to claim to be some like professional medical expert or anything. I just tend to be a curious person. And so I know a lot of things about a lot of different things because I like to learn. And one other thing I wanted to say before we get started is that like a lot of people get really focused on the first year, 2 years, even 3 years of HRT, but you will continue seeing effects for an incredibly long time, like up to 10 years, because let's be real, it's second puberty. And puberty is a long process. No one gets done with puberty in 3 years and completely stops changing. Like, I think that we can all be aware of that. Like, this is a long process. And although it feels like the first 3 years may be like a critical period where like, it's going to lay the foundation or whatever, I've seen people have some pretty dramatic changes even 4, 5 years in terms of like body hair, in terms of like body fat redistribution. So it's a long game. This is a long game we're talking about here. This is not like do this and notice a change next month. And then the last caveat is that sometimes these conversations kind of move into the realm of like, how do you be passable? And passability, in my opinion, is a combination of secondary sexual characteristics as well as, grooming habits. HRT will affect secondary sexual characteristics, but it will not do the grooming parts for you. And that's not what this video is about. This video is all about, the HRT aspect of transition. I'm not touching on like social transition tips. That might be a separate video. So with that being said, tip number 1 is to make sure that you are consistent with the medication. I know this is a simple tip, but it is really important. So first of all, you want to find a form of HRT that works well for you. I know a lot of people will say injections are the best. They're the best, or whatever. And people will say that it's the most effective method. But what they are failing to take into account is that the best method of HRT is one that you're going to reliably take and consistently take. So like in my case, I started on patches for my first year, and then 3 months ago, I swapped to injection. Now, I was doing really well with the patches. I was just getting a little bit of skin irritation. And then also, I found out that it would be a lot cheaper for me to be on injections. I was paying well over $100 a month for my patches alone, and that was a lot of money to be spending on medication every month. And so moving to injections has really helped me save money on my prescription. But the reason why I decided to go with patches when I first started out was because, quite simply put, I felt that it was the form of HRT that I was going to be most consistent with. So if you don't know, the oral tablets can be like 2 to 3 times a day for estrogen. Patches can be like every 3 to 4 days or once a week. I've seen both of those variations on patches. And then injections are usually once a week. I think I have seen twice a week injections for like certain like subcutaneous injections or something. But like for me, putting on a new patch every 3 or 4 days felt like super doable. And I felt like I could be consistent about that, especially with like putting it on my calendar and stuff. The pill form, I was not so sure about. Like 2 or 3 times a day, I feel like my ADHD self would constantly miss doses, and missing doses can be a pretty big deal in terms of your HRT. So like for some people, it may be really easy for them to work in the oral medication to their daily routine. Like maybe they have a very set schedule. And so having the oral medication 2 to 3 times a day is just super consistent, super easy for them. It's, painless. But for me, that is a lot. That's too much to ask for me. Not going to lie to anyone there. And for some people, injections once a week may be hard for people to remember. I know some people that tried to do injections and they kept missing their day. Like they just kept missing their injection day. They go 3 days over, 4 days over, and that is not really a good thing. And then obviously, like some people are afraid of needles. So like if you're terrified of needles, then injections is not going to be the best method for you, because you're not going to do it because you're terrified of needles. Now, I want to emphasize that like having a few mess ups here or there won't make or break things. Like it's not like if you miss your dose twice, you're screwed and you'll never see maximum results or whatever. This is a long game. Again, HRT is something that happens over the course of like 10 years. This is like, these changes are going to be happening for a long time. And it's a matter of consistency over that long period of time. So you want to find a method, a way of doing your HRT that is really easy for you to stay consistent on over a longer term basis. Alrighty, so we're going to be jumping into tip number 2 now, which tip number 2 is about addictions. It's about nicotine, it's about cannabis, it's about drinking. And no, I'm not here to shame anyone. I was an extremely heavy nicotine user before HRT, and also I was smoking a lot of cannabis. Like I had a vape like glued next to me, a nicotine vape, constantly was chiefing on that thing. And then also I was smoking my cannabis, and I was smoking a lot of cannabis, like ounces every 2 weeks. Like I was going through an ounce or 2 every 2 weeks. And that is too much. That is too much. So if you are someone that is addicted to like nicotine, cannabis, or even drinking, we'll talk about drinking too. That is something where you may want to think very seriously about that. You may want to try to come up with a game plan for quitting. Even if you're on HRT, quitting any of those addictions can make a big difference. So we'll start with nicotine. I completely quit nicotine in the month leading up to me starting HRT. It was something my doctor talked to me about. It's something I saw online. There are definitely people talking about this, saying that like, hey, cigarettes and nicotine in general, it's not good for you and it's going to hinder HRT. Now, we are going to need more studies on HRT in general. It's not something that is studied enough. Like it's something that we need a lot more long-term studies on to really know exactly what's going on and what the hindrance is and stuff. But we can just say that there are many negative effects from smoking nicotine or cigarettes that affects what you're trying to go for with HRT. So number 1 would be that like, especially if you're a trans femme, if you're going on estrogen, that increases your chance of having a blood clot, similar to like cis women who have an increased chance versus cis men to have blood clots. You will have an increased chance of having a blood clot. And so smoking on top of that increases your chance even further for blood clots. And actually, you may be advised that you cannot go on something like injections without quitting smoking, because the peak levels of estrogen when you're on injections, it's rather high. And so that means that during certain parts of your cycle, you could have an extremely high chance of having a blood clot. On top of that, the increased risk of cardiovascular disease and the damage to the lungs, not good. Like when you're in second puberty, when you're trying to do the HRT thing, you want your body to be focused on building, on constructing, on reworking, on, all of that stuff. You don't want your body having to focus on like fixing your damaged lungs. Cause if you smoke, your body is constantly trying to fight against that destruction. It's constantly trying to rebuild from all the damage that you're causing. On top of that, you're going to have premature skin aging, something that I know that people don't like. Your skin's going to get tight and it's going to get dry and you're going to get wrinkles all over and stuff like that. You may look a little leathery if you smoke a lot for a long time. Also, there's going to be compromised healing. So like if you get injured or if you have surgery, which many people of the transgender experience will have, your healing experience will be very much affected by nicotine. Some surgeons may require you to go off nicotine in order to have the surgery, or they may just advise for you to do that. Next, we're going to be talking about cannabis, and primarily we're going to be talking about smoking it. So like if you're smoking it out of a piece, or if you're smoking just flower in general out of like papers or anything like that, you should seriously reconsider that. You should try getting more into edibles or into something like tinctures. Personally, what worked for me is that I moved from smoking to a dry herb vaporizer because it's very similar to smoking. It's just less harmful for you. So it kind of let me keep all of the routine things that I was used to with my cannabis consumption or whatever. I know that sounds silly, but people get very into their routines and stuff like that. And it just was appealing for it to feel like smoking, even though it's vaping the herb. I know. But then I moved from a dry herb vaporizer to carts, which may not be actually better for you. Honestly, like there's not enough research done on carts to say whether like the oils and stuff in there are fine to be inhaled and stuff like that. But at least for me, it helped me kind of slow down even more and cut back on my dosage even more. And now I'm at the point where I take a tincture early in the day and then I maybe hit a cart or something like a few times at night or something like that. But I am pretty much staying away from it for the majority of my day, except for the tincture. It helps with the cravings a lot. And I don't think I mentioned this earlier, but I have a medical card. I've had it for like 5 years. So I do have some reason to be doing it on a daily basis in terms of like I have PTSD and I have some body pain issues, and THC has helped me manage symptoms for certain conditions before. That being said, like an ounce or two every 2 weeks that's not okay. Like that's not an acceptable dose for anybody. Lastly, we need to talk about drinking. Drinking in moderation is probably fine. There's probably not much going on there, but especially if you're on oral estrogen that interacts with the liver, you may be putting sort of like double the pressure on your liver by drinking heavily and then also taking these medications that need to pass through the liver. On top of like liver concerns, which is something that obviously you should be getting screened with your blood testing, especially if you are a heavy drinker. You need to be honest with your doctor about any of these addictions that you have, because they will factor that in to the treatment plan, and that will be a part of like what you discussed in your appointments. But on top of that, drinking does slow down the metabolism of fats in the body, and it can actually make it take longer for fat redistribution to happen. So, that's something that we often talk about a lot in transition, something that's desirable, or the body shape changes that come from body fat redistribution, but that's going to be hindered by drinking. So that's just something to keep in mind. Again, in moderation for any of these is fine. Like if you're able to take a hit off of a nicotine vape once a week, that's not going to really do much to hinder you probably, but most people are not like that. Most people are addicted with these things and end up consuming more than maybe they're willing to admit. So as we leave tip number 2, again, I am not shaming anybody. I'm not telling anybody they have to do something. I'm just saying that it is true that these things will affect your progress with HRT, and it's something to consider. Personally, I'm extremely proud of myself for quitting nicotine and for slowing down on cannabis a lot. I don't really like drinking, so that was kind of not an issue for me, but the other two definitely were an issue for me, like especially because like before HRT, like I understand why a lot of people have these addictions. Like dysphoria is horrible. I was mentally at the end of my rope. I was very, very dysfunctional, and I was extremely stressed and constantly flooded with bad feelings. And I just wanted to push it all back. I just needed something to help me cope. And for a long time, heavy cannabis use and nicotine was how I coped. And unfortunately, that's not a healthy coping mechanism. But yeah, that's something that I've heard from a lot of other trans folk, is that dysphoria led to addiction to cope with the dysphoria, which is, you know, it happens. It happens. And I'm not here to blame anyone. I was in the same boat. So, you know, you just got to move on. And so now we're going to move on to tip number 3. Also, if you haven't noticed yet, I am sick. I am very sick. Yesterday, I felt horrible. I probably sound very stuffy and kind of weird. And I'll be real with you. Like, I do not feel great. My brain fog is immense and I am struggling, but I am getting through this video. Okay. I know it's been over a week. I usually try to do like 2 videos a week. Lately, that's been kind of a lot. And especially like in the holidays, seasonal depression, and now I'm sick. It's just been a perfect storm. So I apologize if, you know, it seems like I'm not putting out content as fast, but it is what it is. I will do my best. All right. So tip number 3 is about exercise and how exercise is important. Now, I don't necessarily want to just use that term exercise. I mean any form of movement. So maybe you're really into dance. Maybe you're into yoga. Maybe you're into just going on a walk. Some of those things may not feel like exercise to people because, like, you know, I think some people, when they think exercise, they think like getting your sweat on in a gym and like really going at it, like powerlifting or something. But like, it doesn't have to be that intense. It doesn't have to be that crazy. Like, literally just go on a 30-minute walk, a 15-minute walk every day. That in and of itself, if that's an increase in activity for you, will be a net benefit. Moving in general will help with your metabolism. It'll help, you know, keep body fat redistribution happening, and it'll help you create a body shape that is more euphoric to you and less dysphoric to you. You can tailor your exercise routines to focus on parts of the body that maybe you want to exemplify. Like, a lot of cis females spend a lot of time squatting and spend a lot of time on the elliptical and stuff because, you know, they want to work them lower legs. They want to get that butt. They want to get the hips, you know, they want that stuff to be popping. And like, if you want to have that kind of body shape, you should probably do similar exercises. If you are a trans mask individual and you're trying to go for that super built look, you need to eat a lot of protein. You need to really eat a lot of protein, and you probably want to focus on the pecs and the bigger arms and shoulder muscles and stuff like that. That'll help really create that body shape that'll be more euphoric to you. I know that some people may have limitations in this category with exercise or movement in general, but that's why I'm saying do what's within your capability. I'm not saying that you need to go P90X or do any of that stuff. I actually think that a lot of those things, those workout programs, the high intensity stuff, CrossFit or whatever, I think a lot of that stuff is more damaging than it is helpful. I think that like a consistent, something that you, again, with, it's like medication. If it will fit into your routine and if you'll be consistent about it, that is the most effective form of exercise for you. So maybe you feel like you should be doing powerlifting every day or like 70 squats every 2 days or something. I don't know. But really, like a 20-minute walk around your neighborhood every day is doable and something that you would actually enjoy. And that's kind of a short tip, honestly. I mean, exercise is pretty to the point. Like, it's, you know, there's not much nuance there or anything. So we are going to move on to tip number 4, which is diet. That diet is super duper important. I know I hear people talk about it, but I don't think people talk about it enough. That like everything I said about exercise will apply here, like metabolism, body fat redistribution, all that stuff. Diet will affect all of that a lot. Like, when people are getting into like health and exercise or whatever to like lose weight, they say that like diet is 80% of it and exercise is 20% of it. So if you're thinking about body fat redistribution, stuff like that, your diet is like 80% of it. But on top of like the body fat redistribution, metabolism, blah, 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 on top of that, you need to make sure that you are eating nourishing food and not just food. Now, this can be particularly challenging in today's climate. I often struggle when I go to the grocery store. I'm one of those people where I read the labels on everything. I read the ingredient list on everything, and I'm pretty picky about the kind of foods that I buy. And like, if you're that kind of person, then you already know it's hard to find high quality, nourishing food that's not just full of sugar and junk. That being said, like, if you didn't care about your diet before, understandable. Again, like, I was super depressed. I did not care about my body at all before transition. But now Like it matters to me quite a lot. So like if it matters to you, then you need to consider like the kind of nourishment that you need to help build your body up. So like for instance, vitamin C is really important in collagen production and like, you know, soft tissues, all that stuff. Like you need collagen. It's pretty important, especially for a lot of the effects that HRT is going to have, like on your skin, stuff like that. Collagen is important. So vitamin C is important. Vitamin D is important because, you know, it helps you absorb calcium and it helps make your bones strong and helps them stay strong. And on top of that, you need to make sure that you're getting enough proteins, that you're getting enough caloric intake for your body to do the things that it needs to do. If you constantly undereat or if you constantly overeat by a lot, then that can also really hinder your body's ability to process the nutrients efficiently and make the best use of them. So like something that I've seen some people talk about, and again, a lot of this stuff needs to be researched more, but it may be better like when you're getting started on HRT for the first year or two, try to view that like an extended bulk. So like you don't necessarily want to focus on losing weight when you're early on in HRT. You want to focus on maintaining or maybe even gaining a little bit of weight, depending on what you're going for. And maybe afterwards you focus on cutting a little bit of the weight or something like that. It's just something that I think early on you want to make sure that you're eating enough food. And again, if you're trans mask, you want to make sure that you are eating plenty of protein, that you really want to make sure that you're getting that protein in there. Also, like I know I mentioned vitamin C for collagen production, but depending on your age or other things, you may want to just take a collagen supplement. I highly recommend anyone that's 25 or older, make sure that you take a daily collagen supplement. It like dissolves really easily into liquids. I take one almost daily and it's tasteless. I don't even notice it. I just put it in a little bit of milk and it's great. All right. And so now we are going to move on to tip number 5. And this one's maybe a little bit spicy. I feel like some people might get a little like grr about this one. I think it might be a little controversial. I don't know if that's the right word for it, but I just feel like some people might not necessarily take this the right way, but I'm going to try my best to explain this in a way that makes sense. Tip number 5 is that if you're on HRT, you should seek out some form of talk therapy or counseling. HRT does not change everything, and while it can help with alleviating dysphoria and it can help make your mental state better in that sense, it's not a fix for your mental health issues, and it's not a fix for body image issues either. This is something that I see really often in the community, and I hope that we can create a respectful and kind discourse that helps people understand that like dysmorphia and dysphoria are not the same thing. They are very different, and I think a lot of people have issues with kind of smushing those two together, and they think their dysmorphia is dysphoria. So what I mean by this is like I see people post online, and there are some people who will post and they'll say things like I'll never pass, I do not pass, everyone looks at me weird, and I hate myself, and blah, blah, blah. It gets really severe, like the level of self-talk. It's like very accusatory and very, very negative. But then you'll go and like look at their profile and they're like 100% passable. Like they're like you don't even understand where the issue is coming from necessarily. In situations like this, it might not be dysphoria anymore. Like it might have morphed into a body image disorder. So dysmorphia is kind of like when someone is unable to recognize the reality of how they appear to other people. Like they may think that they're overweight when they're actually severely underweight, or they may think the opposite. Now, again, I'm not tossing any shade. I'm not saying that you have to, do anything on this list. We all have free will. We can all make our own choices. And I do think that in today's culture, we have this air of like, do what you want. And I think that's good. Like, I don't think that that's necessarily a bad thing. I just think that people need to know the consequences of the choices that they're making, and like we can have this live and let live attitude, but I think that should come from a place of like informed decision making, not from a place of like do whatever you want because it doesn't matter, because I think that's a harmful attitude to take. So like therapy can help with these situations a lot. It can help with the dysmorphia. It can help with any body image issues that someone may be having. Talking through these things are often linked to trauma, to other things that are deeply rooted and they need to be hashed out. Like the HRT itself is not like a band-aid for all of your problems. It's not going to just fix any deep-rooted trauma or anything that you're dealing with. Like seriously, it's not going to change how effective HRT is, but it might change how effective you feel like the HRT has been. And sometimes that is the difference. Like for some people that I have seen online, that will be the difference for that person. That'll help them cross the finish line, so to speak, and feel good about their presentation. In this same vein, confidence in your presentation, like if you have had therapy or if you've worked through a lot of your stuff, confidence in your presentation can go a long way. Like sometimes people have a sort of confidence that says like, I love myself. And I think that sometimes that translates into being more confident in social situations, which helps people figure out which way you're trying to identify. So yeah, that's definitely one of the most important things on this list is this last point. And it's something that I hope that everyone takes very seriously. This is a physical journey, but it's also a mental journey. And there's a lot of struggle with it too. Like it's not even just about like feeling confident in your presentation. It's also about like navigating the early stages of transition can be incredibly awkward. Sometimes the social interactions that you have are deeply awkward or unsettling or upsetting. And like sometimes you just need to talk to someone about that. Like for real, like it can be a pretty wild experience going through a transition where like you don't realize how much your life and especially your social life is going to change from before and after. And like, it's an adjustment period for everybody. So even just to talk through the stages of transition and how you're adjusting and stuff, like even just for that, I think it's worth it. But on top of that, there are some very real issues that people might have that HRT will not help you with. But okay, I did it. I made it through it. I made the video. I'm proud of myself. That's all 5 tips. I feel horrible. I have a headache. I cannot breathe through my nose to save my life. I like slept with my mouth completely open last night and I woke up with like the driest mouth in the world. It sucked. It is what it is. I hope that these tips were useful to people or that they helped elucidate ways that you can control or affect how effective HRT is for you. And I just wanted to say, I know that I am trying to do this thing with Patreon where like Patreon members get to see the videos early, ad-free, and I will have an ad-free version available for the Patreon members, but I'm definitely going to release this video instantaneously on YouTube and Patreon at the same time because it's been kind of a long wait since my last video. How long has it been? Yeah, it's been 10 days since my last video. And so I feel like at this point, it's probably important for me to just get the video out rather than to wait another like 3 days where, the YouTube people are like, what are you doing? And in case you weren't aware, I did start a Patreon. It does come with a few benefits. You get to see the videos early, except for this one, and you get to see them ad-free. And also you will get a shout out at the end of the video. And if you are a super supporter, then I will like actually shout you out at the end of the video. So it would mean a lot to me if people were to become supporters of my channel and my platform. I'm trying to grow it. I would like to get an editor. I would like to help fund the things on my channel so that I can make more content, I can make better content and all that great stuff. Also, I do have a Discord. We have over 1,000 people in the Discord now, which is pretty incredible. One of my cats is screaming at me for food, which is lovely. But yes, Discord, we have a Discord. If you go to my description of my video, my Patreon link is there, but so is the link tree that has all of my socials, I think except my Blue Sky. I might need to add that one. Anyway, you have the link tree, click it, opens up the link tree, Discord, click it, you're in. And there is a short verification process, but I do hope to see everyone there. It has been really heartwarming to see people come together since this recent election and to see people build community and build support systems and try to be there for each other. It's just really great to see. I love to see it. I'm not exactly sure when my next video would be. I would love to say like early next week or this weekend, I'll have another video out, but it really just depends on like how long it takes me to get better, all that stuff. Like this video was a struggle to get through mentally for me. Like the brain fog is making it so hard for me to formulate sentences. But yeah, I will be back soon with another video, I promise. If you haven't already, make sure to hit that subscribe button so that you can get notified of my future videos. Also hit that bell notification to get notified of all my videos. Hit the like button and leave a comment down below. Let me know what you thought of these tips, were any of them useful to you, or was I just full of hot air? I don't know. And so yeah, that's gonna be the end of the video. I am considering doing just one video a week and then adding a stream every week. So I'll have like one stream, one video a week. Let me know in the comments down below if that is something that you would be interested in seeing. I have streamed a little bit before in like a gaming kind of thing, and you know, maybe I would do some more gaming streams. I don't know. I don't know what the content of the streams would be, to be honest. Maybe just yapping. I'm not sure. But if that's something that you would be interested in, make sure to let me know in the comments down below. So you will see Patreon supporters scrolling on by down below. I am going to include the free ones for now because like people can just follow you on Patreon, I guess, or whatever. I will include those for now. Maybe in the future, if the list gets really long, I'll just start showing only the paid members or whatever. But I have a new super supporter to shout out. Sarah, thank you so much, as well as Sam. Thank you so much. I appreciate you both for supporting my channel and supporting me growing this platform. And with no further ado, I just have one tiny little favor to ask of all of you, and that's for you to find yourself some water and drink it.